We are back on Inside Politics. Our guest today, Dr. Malinda Button from Vanderbilt University, from the Medical Center there. She's also the Mike Kerb Professor of Healthcare Policy at the University and the Healthcare Center. Dr. Buntin, the Trump administration has long championed work requirements for recipients to receive federal monies. Will that issue likely also arise from the Trump side of the administration when these negotiations continue? Are they going to require work requirements in order for people to stay or be on TennCare?
I believe that's a separate issue from this. Tennessee has already presented to the federal government a plan for work requirements that's under consideration.
Does it include TennCare recipients, the one that the state has put in?
Yes, sir.
And so you think that those two will be the same? The feds have accepted that, but there's been a long approval process, and I think they approved those ideas about that, what, a year, if not 2 years ago, and we're still waiting.
So there are a couple of other states that have work requirements either in place or on the drawing board. Arkansas has actually implemented them, but there are a number of lawsuits related to the way those work requirements are being rolled out, for example, in Tennessee. And so I think that it may take a while for that request to work its way through the system.
Governor Lee says his block grant program won't cut any services or cut off any people that are current TennCare recipients. You seem to indicate they're asking for a pretty generous amount of money to do this under a block grant. Is he likely to be able to keep that if the feds come back and negotiate down the amount of money that TennCare gets for the block grant?
So I try not to doubt people's intentions, but the people of Tennessee remember that in 2005-2006 there was a very large disenrollment from the rolls of TennCare due to a budget crisis. And so when I went to the public hearing here in Nashville about this, I heard a lot of concerns from members of the public that something like that could happen again, and in fact would be even more likely to happen if we were to get a block grant.
The governor, there's been a lot of opposition at these public hearings. I think there's only been one person who stepped up at one of the public hearings in just this past week that said they might be for it. The governor says that the opposition is because people are either misinformed or don't understand block grants.
Well, I guess I have two things to say about that. One is, if you have a sick child and you remember 2005-2006, or your child has recently been disenrolled due to changes in that process, then you're going to have a deep-seated suspicion because of the experiences your family has had. The other part I'd say is that I've been studying these things for 20 years now, and I had to read this waiver amendment many times to really understand what it was getting at.
And you're not still completely sure you fully understand it?
There's still a lot of very broad language about what might happen.
What kind of safeguards are in here to make sure that small subgroups don't take the brunt of any cutbacks, such as the disabled? I think a lot of people in that area are concerned that because they're a relatively small area, they'll be the ones to first take the cuts because there are not as many people to complain about it.
So that is, I think that's always a fear. There are some of those high-risk groups that are just carved out, separate from the block grant, but there are others that are included. Though this request does include a request for more money under the block grant for those individuals, but it would reduce the incentive for TennCare to keep enrolling people with high needs.
Tennessee's also prided itself on how many children are covered under the TennCare program, although there have been some problems with that, with children suddenly finding out they've been cut off and their parents not learning about it until they go to the doctor. Is there a concern about what may happen in terms of being able to keep health care for children under this plan?
I think TennCare should be proud of its record of covering children. I think that the amount of money set aside in the block grant for children is commensurate with what they're spending now. It's just hard to predict the future, and if we have a real state budget crunch, that could be a risk. It's
hard to predict the future, but normally we know that eventually there's going to be a recessionary time. Is there anything in this block grant proposal that would protect the state during a recessionary time when those rolls for TennCare always balloon?
Yes. In the act passed by the General Assembly, it did say that TennCare should ask for part of the money in a strict block grant, and part of the money would come through extra money per newly eligible person. So that would give the state some protection in case of recession.
Tennessee believes it can do a better, more efficient job of delivering health care. What kind of things are they talking about that will save costs? Because most people believe, like death and taxes, that health care costs always go up.
Well, what Tennessee is saying in this proposal is actually that they're already doing a great job and saving money, and they want the federal government to share some of that money back to keep giving them the incentive to run the program efficiently. So they're not proposing a whole lot of new programs to build on the efficiency. They're just saying, give us credit for what we've already done.
Prescription drugs is one of the things that constantly drives costs. The state wants to be able to negotiate that separately. The federal government wants to do more about negotiating prescription drug costs. That sounds like there's going to be a little tension and push and pull about that. Who's going to win on that one?
That one is hard to make a call on. What TennCare is saying is we don't want prescription drugs to be part of this at all. We want them to be separate from any block grant. The federal government has proposed a number of things related to prescription drug pricing, but fundamentally I think it's likely drugs would stay out of any negotiation because the federal government has already looked at a similar proposal to what TennCare wants to do and told the state of Massachusetts that they just can't do it.
But I do understand that the way this is set up, that the state is asking on prescription drugs that they be required to cover fewer drugs, which means even though the governor says nobody's going to get cut back, there may be an initial cut because people who are getting a drug under TennCare won't be able to get it in the future. How are they going to explain that?
So it is true that they are asking for the ability to put in place what is called a formulary. And those of us who get coverage through our employers might be familiar with this. Maybe the brand name drug costs a lot more or isn't covered at all. I don't think the federal government is going to be able to grant them this authority. So although it looks alarming on paper, it's one of the things that I would be least concerned about because, again, the federal government has already told the state of Massachusetts they can't make that change.
Given the amount of people that aren't covered by TennCare that have health care needs, if the state and the federal government are able to save money, why isn't that plowed back into delivering more health care? Why isn't it taken to give back to the federal government for whatever they want to do to further fund the deficit in this case? And what's the state going to do with it? And why shouldn't the state spend that on health care since that's a direct drag and cost to our economy?
So what the state says in the text of this proposal is that to the extent that they save money, they want to share it 50-50 with the federal government, and they say that they will take their half that they save and put it back into health care. But what exactly they would put it back into, the proposal does not spell out.
Dr. Malinda Button from Vanderbilt University. She's the Mike Kerr Professor of Healthcare Policy there and the Chair of the Department of Health Policy at Vanderbilt University Medical Center. We're talking about TennCare and the future block grant provisions for that. Back to continue our conversation after you watch these messages.